Chamber.
Councillor Brennan.
Present in the chamber.
Councillor Brooks.
In chamber.
Councillor Cassidy.
Present remotely.
Councillor Daisley.
Present remotely.
Councillor Jackson. Councillor Long.
Present remotely.
Councillor Moran.
In chamber.
Councillor McCabe.
Present.
Robert Mackenzie.
Yeah.
Councillor Robertson.
Present remotely.
Are there any declarations of interest?
Yeah, so I've got a declaration for 6, which obviously private business, but there's increasing family connections. I'll have more information required at item 6, but both I don't have any governance or financial with any of the suppliers, so I wouldn't believe to leave chamber, but it's for nothing on that.
Thanks very much for letting us know, and I don't see any other declarations either online or in the room. Thanks very much. So that takes us on to item number 2, which is the Revenue and Capital Budget Report, and I think Craig Given, you're going to take us through that. Thank you.
Thank you. You've been through yourself. This is our finance paper that we bring forward in the cycle, and it covers a number of new areas. It covers a period 5 projected 25-26 outturn, current capital and a reserve position. As at period 5, we're currently projecting an overspend of £672,000 in the social care budget. For completeness and transparency, the health part of the HSC budget is showing £718,000 underspend at period 5 also, and this gives a total partnership underspend of £46,000. However, this report focuses on the social care element of the budget, and I'll now give some more details on that as I usually do. There are a number of over and underspends within the overall budget. The main driver for the overspend is due to children and families budget projecting a £3.4 million overspend, and this is mainly due to residential placements and child respite overspend at period 5. This forms part of the overall children and families redesign that Margaret and team are currently taking forward, and additional funding from Inverclyde Council this year as part of the budget process is helping with this overall review. We also have the use of the non-recurring pension monies to assist with the smoothing of the children and families budget, and we're using this to help us within the overall budget. We're showing this funding in the corporate director line transparency just so we can see that. This also is partially offset by underspends and older persons that can run disability budgets. The other factor contributing to the overspend at period 5 is the work still ongoing to deliver the new voluntary release target, as highlighted in section 3.2.7. This still needs to be achieved, but the SNT are actively working on this area, and we hope to have this process completed by the end of 2025. If this overspend remains at year end, we'll use the use of smoothing reserves to bring this position back to the break-even position. The next section highlights HSCP progress to date with the achievement of areas brigade savings, and this is seen in section 3.3.7. And as you can see, we've already made good progress in the delivery of our savings, and it's the £400,000 new VPR target is the only one that we still need to achieve. We mentioned that earlier on. Moving on to the capital section, section 4 shows the capital position. The Community Hub capital project has already started, and this section highlights the spend to date. Appendix 5 shows our overall earmarked reserves, and this shows we started the year with 17.144 million, and we expect to finish the year at 12.045 million based on our current projections. As always, Molly, there's a lot of information in the report. As always, happy to take any comments or any questions in the member.
Thanks very much, Craig. I'm just taking round the room. Councillor Armstrong.
Thanks, Convener. Yeah, it's just please a bit of clarification about the projected overspend, notwithstanding your comments at the start about the underspends on the health side. I just want to be absolutely clear about the projected overspend on the social care side. Paragraph 1.2 says has a projected overspend of 6.72 million. Paragraph 1.4 comments on the use of 0.417, the smoothing reserve. So I just want to know, does the 0.672 include is that counted in that figure, or is it in fact 0.672 minus 0.417? Thank you.
No problem. Through yourself, convener, yes, the use of the smooth reserves is included in that
Right.
figure, so that is a position, sure.
Thank you very much.
Thanks very much. Councillor Moran.
I think, it's just on the pension money that you see the non-recurrent basis reports. The money went to the DG of Children's Family Service and used the budget 24-25. This would use fuel to offset the overspend current projected, which we know about. But it should be voted at 25-26, the 5 year of this temporary funding. I mean, if it's not, it should be landfill bringing somewhere. If we've used this windfall for plug a gap this year, but going forward, that windfall don't go available. So I really just need some assurance that we're looking at this now going forward. So when this money is not available, we can pick up the shortfall and certainly tell families the runaway train at home. We know that with this lucky break, we won't be here next year.
Thanks very much.
Yeah,
Craig.
happy to come in there. Through yourself, convener, totally agree and totally understand the comments said there. That's correct. It is a windfall we are using it for this financial year. Our longer term, medium term financial strategy includes the impact of this dropping off going forward. And we're showing that for next financial year, over the next 2 financial years, we've got a £7 million budget gap on that side of things. The SMT, and one of the main drivers is the use of this and that coming to an end. Please, at this moment in time, rest assured that the SMT are actively reviewing this. We're looking at savings proposals and we're going to bring them forward to future IJB sessions, but we'll also filter it through this group as well.
Okay.
Thanks, guys. Good to hear.
Thanks very much. I don't think any of the other officers want to say anything on that at this time. No. Okay, but thanks for giving us that response. Okay. So I don't see any questions or hands up online. So are we happy to agree the recommendations on page 2 of the report? Thank you. Okay. That takes us on to item number 3, which is the HSCP Annual Performance Report 2024-25. So I think Jonathan's going to just start first. Thanks.
Thank you for being through yourself. Just before I want to stop Brian, who's our service manager for planning, performance and qualities. The purpose of bringing the HSCP's annual performance report here today was to provide an update on progress against the 4 strategic priorities which underpin the partnership strategic plan. As a partnership, the plan and the annual performance report itself reflect work across social work and social care, but also delegated NHS services within the health and social care partnership. Scott's going to take the members through the progress over the past year at this point.
Thanks very much. Thanks, Scott.
Okay, thank you very much. I hope that's the slides shared. I think there's some limitations, but you can see that before. So, yeah, thanks very much. So I'll take you through an introduction to the HSCP's annual performance report. So just to highlight, this report was approved by the Integrated Joint Board on the 8th of September this year. Jen provides an overview of activity over the past year, 24-25. So I'll take you through that in a bit more detail. Okay, so just in general, the annual performance reports are a requirement on all IJBs and HSCPs across Scotland that's set out in the Joint Working Scotland Act. And the really evidence is how through our joint up working between council services and NHS services, we can help improve the health and well-being of the people in Inverclyde through those joint up services and approaches. So the chart of the diagram on the right just helps evidence that showing that basically the delegated services that come from Inverclyde Council and the NHS are channeled through the Integration Joint Board into the HSCP as a delivery mechanism, and it's through that joint up working that we can provide better services and more joint up services for the people of Inverclyde to help them live long and healthy lives. The APR partly demonstrates how we are progressing towards a strategic partnership plan. That was published last year, which is People and Partnerships Making a Difference, and also how we're performing against the international health and wellbeing outcomes. And again, they were established through the Joint Working Act as well. So, what I think is worth mentioning, this is the first annual performance report against our strategic partnership plan that was published last year. This is the APR overall, again, the first one against this partnership plan. The key focus on it is addressing that focus or addressing that progress towards our 4 strategic priorities, which are highlighted there, which are provide early help, improve mental health, wellbeing and recovery, strengthen families and carers, and also safe and resilient communities. So the overall focus of the report is how we progress towards those 4 strategic priorities and helping to improve health and wellbeing and work-life. So in terms of how we developed the plan, we took a new approach this year with the new plan. Throughout the year after we published the strategic partnership plan, we established 4 priority groups who would basically take responsibility for overseeing the implementation of the strategic plan in each of the priorities. So each of those is chaired by a head of service, and each group contains a wide-ranging membership from colleagues right across the HSCP and partner organisations as well. So on a regular basis, we come together to discuss how we're actually progressing against the plan, and it really helps provide a really deep conversation in terms of the progress that we're making towards the partnership plan and what it does as well. So where we have specific actions that we'll be delivering in a specific area, there's a lot of networking, a lot of cross-working right across the partnership, and those conversations really help to bring the true value of the partnership to life. And it was through those conversations that we developed and identified the key aspects of this annual performance report. So, as I think I've highlighted before, the key aspects of our annual performance report is our journey towards those strategic priorities. So I'll just go through and give you a sort of key highlight of each of those. So there's 4 key strategic priorities. So the first one is to provide early help. And the goal of providing early help is to ensure that people in work-life, whenever they have a health and wellbeing concern, they'll be supported and advised at the earliest possible stage. So that could be somebody with a concern within their community, so we'll have access and resources within their community to get that advice and help in the early stage. If there is a more deeper concern, but they need to access statutory services such as a GP or a social work service, regardless of where they come into their services, they will be supported and directed to the appropriate services as soon as possible. So that's that priorities hopes to achieve. So some of the examples that are integrated front doors work that was initiated over the last year. So that piece of work is looking at how people access their services in the health and social care partnership and how we can actually streamline that and make it a more smoother and a faster journey for people who have concerns and want to access their services. So that work is ongoing. Currently they're reviewing all the processes across the partnership and now generate a phased plan in terms of how we want to improve our people accessing our front doors. Also within that we have increasing housing and homelessness services. So this is in alignment with the forthcoming closure of the Riverplate Centre, but it's how we better support our people who face risk of homelessness through more community-based approaches and supports. So that's a highlight from providing early help, and also there are more in the API itself. In terms of our next priority, which is improve mental health wellbeing and recovery. So this is looking at the rising demand and challenges that people face in terms of mental health across Inverclyde, and also looks at addressing the serious concern of alcohol and abuse within Inverclyde as well. So just some of the key highlights from this. So the one is about supporting young people's mental health and wellbeing. So we've been forming capacity in our Health for All team, our emotional wellbeing triage meetings, and also there's a high uptake of the digital platform which supports children and young people through an online version of mental health support. And that's led to positive improvements across young people with mental health support for them. We made improvements in our alcohol and drug support pathways. So there's been a new alcohol recovery pathway established by an alcohol and drug recovery service, and that's in line with the MAP principles across Scotland, and it ensures people get the timely support and access to services. And also, in addition, our alcohol and drug partnership has transfers for access to residential rehab services for those who are affected by drug harms. So that's one of the key highlights as well. And we also have improving access to community mental health support. So over the past year, our Community Health and Wellbeing Hub has improved access for adults across Inverclyde. And through enhanced partnership with our community learning development colleagues, people have been able to access more low-level support within the community. Under inclusive, safe and resilient communities priority, so this is looking at ensuring that our communities in Inverclyde are robust, resilient, safe places for people to live. So our community should be a place where we can feel safe and be a place where we can recover and feel healthy and well. And the focus of this priority is to ensure people have the resources backing within the community to have that level of support. So one of the key highlights here in terms of new ways of working for children and families. So over the past year, through 24-25, Children and Family Services improved its child protection outcomes. As evidence have less children on the child protection register were on there for a less amount of time. So 89% of children who were registered spent less than 1 year on the register throughout that year. The service has also undergone a wide change in terms of its redesign and implementation of the Signs of Safety programme, which is a strength-based and relationship-based approach to social work and social care. So that's been rolled out to, I think, all staff within children and families, and same has now been rolled out to partner organisations as well. And I believe that make a real change to how we support children at risk within Inverclyde. Through our partnership engagements and working in partnership with our colleagues in Your Voice, we developed a range of programmes that have reduced social isolation for local people, which is obviously a key challenge to people remaining healthy and well if they're socially isolated. So those programmes and opportunities have reduced social isolation and improved social connections across Inverclyde. And in the past year, we engaged with over 2,100 people through online events and outreach support. I think it was over 200 people have come back and regularly attended peer support groups and events. Finally, our fourth priority is strengthen families and carers. So this is looking at the focus here is on supporting our families and carers, as our households and our homes are probably the best place for us to receive care. So it's making sure that families and our carers have that absolute capacity to continue in that caring role as to look after us and themselves. So some of the highlights there is digital support for families. So this provided through our early years team is the online apps for Happy Healthy Talks in the Henry apps, which provides young families and children much needed advice and information as they go through the process of caring for their families and supporting families affected by drug or alcohol use. So in partnership with the ADP, we commissioned the Scottish Families Affected by Drugs and Alcohol Service. So this is a service that actually supports the families of people who are affected by drug or alcohol use to provide that a greater capacity for them to support their loved ones as they recover from alcohol and drugs. That's the overview of the improvement journey in terms of how we've highlighted the four strategic priorities. What we have also progressed towards last year is how we work in localities. So the HSE has two health and social care localities. So one is in the east locality and the west locality, as evidenced by the small map on. So over the past year, we've made great developments in that. We had a development session in November last year to look at how we would structure and deliver those groups locally. So over the past couple of months, we've been enhancing our membership, so looking to grow that membership and ensure we get the right people around the table for having these local conversations, clarifying governance routes. So obviously what happens at our locality planning groups, that voice should effectively be heard at strategic integration group, so we've been clarifying those routes as well. One of the things that happened last year we were really proud of is that through feedback from our locality groups as we've revised our strategic priorities. Following discussion, we felt that some of the wording that we had originally used when we published our strategic plan last year wasn't very reflective of what people wanted to hear. So, for example, one of our priorities was to provide early help and intervention, and then that's now moved on to provide early help. I think they felt the word, actually the feedback was the word intervention actually suggested we do two people as opposed to working with them. So how we've rephrased and redrafted the strategic priorities now more in line with our division and the approach to the partnership and that collaborative working and actually bringing out the assets and strengths and local people to care for themselves as well in partnership with us. So there is a section within the annual performance report on finance and best value. So our financial performance is also highlighted there. So it highlights where our key areas of spend were. So obviously that looks like Health and Community Care had the highest spend within the HSCP over the past year, followed closely by Children, Families and Justice. What was highlighted was that the largest social care pressure was in children and families, and that's with the residential care budget. But as highlighted, there is work ongoing through the New Descent to actually address that, and going forward, we hope to help that New will actually address that over to bring costs down. Against health grades pressure was in the Scrutiny budget, but again, work is ongoing with our pharmacy colleagues looking at how we provide alternative medications and review prescriptions in order to bring that down. So that's certainly something there. And we have an inspection activity. So over the past year, there was a number of inspections that were undertaken through the Care Inspector Health Improvement Scotland. So some of the services that were inspected were mental health, early and difficulty in care home services, fostering adoption and continuing care, and the View, which is a children's residential house. And in most cases, inspections identified that there is great strength and positive working practice, but also where there was recommendations or improvements to be made. There was improvement plans that had been rolled out as well. And then just in terms of measuring our performance, so what we have to do is we have to measure our performance against 3 national performance frameworks. So those are the National Health and Wellbeing Outcomes, the Ministerial Strategic Group, and the Local Government Benchmarking Framework. Within the APR itself, there is part explaining how we perform, the appendix guidance report, but just some highlights from that in terms of against our national health and wellbeing outcomes. We've highlighted that we had the people who spent reduced time in hospital for those 75 and over by 35%. Overall across Scotland, we ranked 5th out of 31 HSCPs for that measure, so that's a positive performance. And in terms of the number of adult readmissions, we ranked a 6th out of the 31 local authorities in terms of performance there, despite a small increase in the number of people readmitted to hospital. For our ministerial strategic group indicators, we achieved a 44.9% reduction in unplanned bed days for geriatric home stays, and we achieved a 53.1% reduction in adults experiencing a delayed discharge from hospital. And just finally on this slide is the local government benchmarking framework. So what we had there is an increase in the number of local carers who feel supported to continue in their caring role. And also that goes back to one of our strategic priorities about strengthening families and carers, so that's a positive bit of information. And we ranked 6th out of 32 local authorities for the percentage of adults who were supported at home, who agreed that their views were included in how their care was provided. And again, that's something that's very important to us, ensuring that people who receive our care are at the heart of their care plans as well. That was my final slide, and happy to take any questions.
That's great, Scott. Thanks so much for that. That's really cool information there, because I know loads of times we can get the report and then it's just directly lifted onto the presentation, but you've really brought that to life and given us some extra pieces of information there from that to draw it out for us. So no, that's great. Councillor Armstrong.
Thanks, Sabrina. Yes, I'd like to echo what you said. I think it's fantastically readable report. First of all, because some of these things can be a bit dry, but I thought it was very readable, very clear. I just have a couple of points that if we could possibly expand on. One is on page 19 of the report, page 37. It's the box near the bottom about a measurable decrease in IRDs, and I wondered if somebody could just tell us a wee bit more about that. And if will I just ask the other bit as well? I'm on page 69 of the report, big page 87, just over halfway down there. In the slide reported a 4.3% increase in direct payments, and reported is 7.1% higher than Dr. Aberdeen, ranked 2nd out of the 32 local authorities. I think it's worth highlighting that and drawing that out, because it seems to me to be a very, a very good, good news.
Thanks very much. Thank you. Listen to your first point. I'm just thinking, is it go to Margaret for that? Yeah, thank you.
Thank you, Karina. So I had these interagency referral discussions, and they're very early discussions when one of the partner agencies was concerned that child was at risk of significant harm and they required protective processes. and they bring together social work, health and often education. A reduction in IRDs is viewed as a positive thing in the context of this strategic plan, because what the strategic plan and some of the performance highlights is, and this is particularly true across the health and social care partnership, but included in children's services, there has been a very strong focus in early intervention and prevention. And that's through health, through education, and through third sector partnerships that the Health and Social Care Partnership have. And I suppose our analysis is telling us that that investment, the shift in early intervention and community support will be having a direct link with a reduction in concerns potentially about children coming through into our front-loaded children's services at request for assistance. And we do audit our IRD activity and will continue to audit it, but certainly whilst I will always remain cautious, this is a positive indicator that the broader health and social care strategic plan, particularly around that principle of early intervention and help, may be preventing children having to come in deeper into the system.
Okay, thanks very much. Thank you. That it's literally a sign of safety, but I know you're never taking your eye off the ball at all with any of that. But no, that's great to hear. Thanks very much. Thank you. Robert Mackenzie.
Thanks, Convener. Yeah, thank you for the report. It contains many positives. Page 11 of the report, halfway down, while levels of poverty and deprivation are high in Inverclyde, they are not spread evenly among the population. This figure 1, which was areas of high deprivation, are not dispersed across Inverclyde. High deprivation are clustered, particularly in Port Glasgow and the east end of Greenock. Now, I'm here, ward councillors for Port Glasgow and the east end of Greenock. I work in Port Glasgow every day of the week, and I see these problems every day. Is there anything being done that's focusing on Port Glasgow and the east end of Greenock in particular? Is there extra resources we put into these particular areas? And how do you measure if lives get better for the residents of that area?
Yeah, so yes, I'll come back and so that's absolutely a priority within the partnership plan, is that we do focus our resources in the most appropriate areas. So that's what we're hoping to achieve through locality conversations as well as identifying what those things are. In terms of how we're redirecting our resources, I will maybe refer to some of my colleagues, but yeah, absolutely, I think maybe based on my colleagues and how we could answer that, how we're redirecting our resources, if that's okay.
Thanks, Jonathan.
Thank you, Convener, through yourself. Robert, I suppose that immediately I thought back to the locality planning groups that we've established, specifically because although Inverclyde in terms of our geographical split might be small, as you rightly pointed out, there are quite significant variations across our different communities, and where we've seen through the national statistics and also our local work where there are those areas of greater deprivation and other challenges, I think the East and West locality groups are well established to be able to reflect those particular local needs. One of the aspects of the strategic activity around our partnership plan is how we link with the broader Child Poverty Action Group and some of the other anti-poverty activity across Inverclyde as well. And I suppose one of the more recent developments, or one of the areas under development at the minute, is the work that we're doing around Upper Port Glasgow, specifically around Stone, and looking at the community of kindness approach there, where we're really taking a public health approach to things like social isolation, food poverty, etc. And I suppose that really will give us the opportunity to work in the most broad way, not just within the partnership and council, but really aware of the strong communities that we have in Inverclyde and the third sector representation as well, really in terms of that place-based approach. I suppose one of the other elements that we are considering a bit more strategically at the minute is how we plan our HSEP services for the future, and whether that would be enhanced, not just because of the complexity of needs and some of the real challenges in our communities, but also in view of the financial envelope that we operate within, whether there's an opportunity to take more of a locality-based approach in the future. So that's one other element that we're looking at from a strategic point of view as well, and I would expect that we'll see more work from a locality-based approach coming through in future reports as well.
Okay, thanks very much, thank you. Councillor Brooks.
Thanks very much, Convener. Yeah, it's a welcome the report. It's advice very, very much. It's very clear, as already has been said. But throughout the annual performance report, we keep on hearing, and I welcome, I celebrate the third sector. We hear the briefs a lot and relying a lot. But my question is, how about the reliance, the resilience of the third sector? Because we seem to be putting so much in the plate onto our very stable and very quality third sector. But if one goes down, it could be challenging for the services that we're commissioning or delivering with them. So I just wonder, how do you check the resilience of the third sector in the plate?
I wonder, I'm sure you'll be fighting amongst yourselves to take that, and I suppose I know there's we go into our external organisations later on in the report and talk about them, so there'll be people here who know a huge amount about the resilience of the third sector and all the challenges associated with 1 year funding instead of multi-year funding. I'm not sure if anybody who feels most. Yeah, Jonathan, thanks very much.
Thank you, Convener, through yourself. Craig may want to come in as well, but I suppose just in terms of that important third sector presence, as you point out, Councillor Brooks, is one of the real strengths in Inverclyde, and again, I think we really do benefit as a community with that third sector presence. Sometimes small organisations, some much larger national organisations, as we know. I suppose in terms of commission services and some of those formal relationships that we have with third sector, they're subject to the rigour and the scrutiny of our governance arrangements through our commission services, but also in terms of some of the best value challenges that we have to meet in terms of commissioning bespoke packages of care or some broader service level agreements, they'll be subject to, I suppose, the rigour of the financial viability of providers, but also in terms of being able to meet those needs at local levels. So we have seen nationally some challenges for some third sector organisations in terms of capacity, in terms of recruitment, but very often they are very flexible, they're very mobile, and they're very keen to engage in communities such as Inverclyde. And in fact, we've just seen children and families in the last month a significant award to a key third sector partner who will support our work around intensive family support. But there's obviously a critical aspect to any of those formal arrangements in terms of the resources to support that contract, but also the sustainability of the provider themselves.
Thank you.
Thanks very much for that question, Councillor Brooks. Councillor McCabe.
Yeah, thanks, Chair. It's a fairly broad question. I mean, the report provides a lot of useful information, a lot of statistics as well, and presentation. Some areas where performance has improved in the last year. So, but there's a lot of stuff on in here also, and looking at the 5-year trend. And I probably am more interested in the 5-year trend and what the information there is telling us. It probably is a mixed bag, and I think you've got to recognise within that 5-year period there's been a pandemic as well. So I suppose it's a pretty broad question, but in general terms, are we seeing things moving forward? Are we seeing health and well-being improving, or are we seeing it staying static, or are we seeing it deteriorating? What's your overall perspective? And recognising obviously the last 5 years and the previous 5 years have been periods of great challenge for public resources as well.
Yeah, no, I think I'll agree with your point. It's a mixed bag. There's a lot of indicating things we are getting better, and we are moving in the right direction. Others maybe not so much, but I think we're maybe not achieving where we want to be. That's where we're directing our resources and identifying how can we actually do better in that. But no, I think generally we are moving in the right direction. I think, like I said, COVID is still with us, but I think we're moving beyond that now. We're actually getting to a place where we are making significant improvements, and actually seeing that across the piece as well. I think we're also need to improve as well as in our own measures and our own outcomes framework, which we're still developing, and that gives a better picture of how we're actually impacting and improving the lives of people in Inverclyde. So I think the national measures gives it a mixed bag, but I think overall I think we're actually seeing a positive trend of how things are improving in Inverclyde.
That's helpful because ultimately, at the end of the day, it's about outcomes, isn't it?
Yeah.
It's about making people's lives better. rather than measuring inputs and outputs, measuring outcomes. Thanks for that.
Okay, thanks very much. Oh, Jonathan.
Sorry, for yourself, convener, just to add to Scott's response, Councillor McCabe, I suppose the range of measures at the back of the annual performance report itself allow us to really track not just our local progress and areas of challenge, but also against some of those national trends as well. But you're absolutely right, as we often say in this forum, the enduring impact of the pandemic continues to be with us, and really, I suppose, the complexity of need, not least of all through our mental health services, is testament to that, and the ongoing challenges around the cost of living in communities. But I suppose really the challenge that's reflected in the report is about how we work with our communities to respond to some of those health challenges, particularly around how people can live well, how we can live in a risk-sensible approach, I suppose, as opposed to being high risk, and thinking also about how we can support people to live better with long-term health conditions and self-management there as well. So one of the elements that we are continuing to refine, as Scott says, the outcomes framework, and we're also going to be developing a specific social work performance framework over the next few months that will not just look at some of those statutory interventions, but also some of the broader population measures as well, so that we can have an eye not just, as you say, on inputs, but it's always about impact and outcomes and improving those outcomes.
Good. Thanks very much. The report obviously talks about, and you talked about, Scott, the 4 areas, one of which was mental health. I know Margaret and Jonathan have both kind of referred to work across sectors. Some of us yesterday were lucky enough to be in Inverclyde's new pupil forum with young people from all across Inverclyde, and they wanted to talk about health and wellbeing and mental health. But I think, you know, we were all blown away by when we talked about mental health and what was working well, the responsibility that they were all taking for better mental health, that and they were able to kind of rhyme off really quickly different strategies and different approaches that they're using for better mental health. That it would be great if we start to see a lot of these things bearing fruit and having positive results for them as that particular cohort get older as well. Okay, so thanks very much for all those questions and comments. We just need to note the HSCP annual performance. Thank you. So on to item 4, and this is about our social work recruitment activity that we've kind of kept a close side eye on to describe it on this panel, but this is a bit more of a focus on it today. So thanks very much, Jonathan, for bringing this report.
Thank you, convener, and through you as members are aware, locally and nationally, there have been challenges around the recruitment and retention of social workers for a number of years, and again, particularly exacerbated by the impact on the profession and by the COVID-19 pandemic, and also some competition between local authorities as well. Within Inverclyde, we know that a high number of our staff are from the local area and choose to work here as well. However, we have experienced times of prolonged high vacancy rates over the last number of years, and recruitment activity has really sought to address that, given the impact that high social worker vacancies have on the partnership's capacity to undertake those statutory duties. So we have had some success with those more traditional recruitment drives, but it's clear that a more sustained range of activity was required, and the paper provides some information on the actions that we've taken within Inverclyde over recent years. The first area was the development of the Group Our Own initiative, which provides the opportunity for existing staff, paraprofessional roles, to undertake the social work degree. And to date, 15 staff have commenced the social work qualification across all service areas, so across children, adults and justice as well. 3 of our colleagues are expected to qualify by May, and 6 more candidates have commenced their studies last month. And I suppose one of the appeals for our own is the fact that people who are already employed with the HSCP can continue to work for us, but they're supported financially with the cost of fees to undertake the qualification. And it means then whenever they do qualify, they move into a social worker role upon completion of their studies. There's also a fair programme of support ongoing through the time that people are undertaking the qualification, and that extends whenever people take up posts either through that route or joining organisations as newly qualified social workers. We have continued to have connections with a number of universities where we are promoting Inverclyde as an employer of choice, and through that we have a high number of people joining the organisation who are newly or recently qualified, and that's reflected across the picture nationally too. So the newly qualified supported first year is a programme of intensive support that has been piloted in Inverclyde before it was rolled out nationally last year. And we have a small number of people, 3 social workers, participating in that supported first year currently, and more will join as they take up their posts. Third area that's highlighted in the report is the support to final year master's level students. Master's level qualifications in social work are not funded nationally, so the cost of fees could sometimes be a barrier to people undertaking the qualification. So in response to that, the HSEP has funded 4 master's level students to finish their qualification in exchange for them committing work for Inverclyde. So overall, those initiatives have had some good success in effectively seeking to offset recruitment and retention challenges. They will never be enough to completely eliminate the turnover of social work staffing, and we're also keenly aware that other local authority areas are undertaking their own initiatives. So it's really important to highlight the fact that the partnership remains committed to these approaches to remain competitive, to support our existing workforce, and also to help to remove barriers that could otherwise deter new staff joining the organisation. Happy to take any questions.
Thanks very much, Jonathan. No, that's great, and just, I know we've said it before, but great to see all those different local approaches really working and making a difference to that ongoing recruitment challenge that we face in different parts of the HSCP. So no, that's great. Councillor McCabe.
I think Councillor Moran is
First,
a micro second.
That's so generous of you.
I was just going to add, I mean, this is a helpful report, gives us a bit more meat on the bones. Obviously, we've had previous information, but you've got a platform here, Jonathan, right? An opportunity where I think we're streaming this. It certainly will be available on the Wild Wide Web, and I'm sure there are reporters somewhere in the background. So if I was to ask you to sort of speak to the young and not so young in Inverclyde about why a career in social work is a good career, what would you say to them? What would you say to encourage people to pursue it? Well, no, we're trying to encourage people not to. What would you say to encourage people to pursue it?
Thank you, Councillor. Yourself, I suppose, I mean, I go to a personal place, I suppose, and I didn't go into social work straight from school. I came in later in life, and it was a conscious choice because I did want to try and make a difference to people. And I think that whenever I speak to social workers, and whenever I reflect on speaking to social workers through my management career, it's still that absolute commitment to being able to make a difference. And having worked in large local authorities and smaller partnerships such as Inverclyde, I think one of the things that I like about working in small partnership areas is that you can actually see changes taking place sometimes quite quickly. That if you've got a good idea, it can be heard, and you can see how that is tested out and implemented. I think that the diversity of work in social work, it's never dull. And I think that the advances that we're seeing to support how we support people as experts in their own lives, particularly around digital and thinking even about AI, and that is quite challenging and daunting, maybe just to me in my dotage, but certainly I think that the place of digital in social work is something that's really quite dynamic and really interesting to see. I do have some social work colleagues around here as well who may want to come in, but I do think that as a profession, the opportunities are huge for people to be able to learn and to develop. And I suppose we work, as I say, working in a small partnership area like this, there's an opportunity to really be part of making that change. So I think it's a terrific opportunity for people to join the profession. I think that we really felt the impact of COVID, and a huge number of people of an earlier generation retired, and there was a considerable shift, not just in social work, but we saw it in health services and other professions as well. We saw a significant knowledge gap there that had to be filled, and we saw people getting opportunities to develop their careers as a result of that. So I do think that there's a huge opportunity for people to make a difference, but we know that there's significant challenges in the public sector, not just in social work, but I think the strength of the profession is borne out by what we achieve locally and nationally. So I'm at risk of making a speech, but I hope that's some.
No, that's helpful, but I suppose to follow that up, in terms, I suppose, what we do locally to try and attract people into the profession, is there more we could do in terms of that? And I suppose nationally, is there more that government can do to promote the profession and support the profession? Because you are competing with other professions, that's the reality of it. You're competing with education, you're competing with health, etc.
Absolutely. And again, through yourself, I think one of the big challenges is evictions and conditions. And pay is always going to be something that particularly newly qualified and recently qualified social workers look at. And it is a competitive marketplace there, there's no doubt about that. I suppose one of the successes that we found in my time in Inverclyde has been where we've been able to take the benefits of working for Inverclyde out, for example, to universities to engage with final year students, where they're obviously a prize commodity, and it's about not just what we pay, but it's about the ongoing support, it's about the learning and development offer that we have here, and it's also about, from a national point of view, and some of the work that I'm involved in nationally, being aware of innovations and approaches elsewhere, and thinking if there's a way that we can actually adapt some of those ideas for Inverclyde. So I think nationally development of the National Social Work Agency on the back of the amended legislation following the National Care Service debate we've had in recent years is something that we don't know how that's going to shape up, but the development of the executive agency around the Chief Social Work Advisor to Scottish Government's a positive move, I think, in terms of being able to put social work as a profession at that national level and very much on the government radar. But as I say, colleagues may want to come in terms of their own experience of social work, but I think that the competitive marketplace for social workers joining Inverclyde or another local authority is always going to be a challenge. So I suppose it goes back to the purpose of the original report. If we've got paraprofessionals already working in the organisation, how do we nurture them, how do we retain them, and how do we enable them to develop and grow as social workers for the future?
I think I've challenged you enough.
No, that was really interesting to hear that response though. I think from Jonathan, and I'm sure we don't go so far as to say it was inspirational as well. Yeah, we'll see. Thanks very much. Councillor Moran.
Aye, thanks. Give you that. It's probably something along like Stephen. Grow your own is a really good initiative. But John, I don't remember a wee while back I was contacted by a lady in Australia who was an expat, very, very highly qualified, and she told me she was hoping to shoot an opportunity to relocate back here in Inverclyde. Now, I don't know what happened to that individual, suppose I really care, but how far can we cast our net to recruit people? And if you're the relevant qualification in Australia, would you count to be a social worker in Scotland? Or even if you're an English qualification, would that cover you for Scotland? It's just that, if there's people looking to come back, or there's an opportunity, how far do we cast our net and encourage them to come back home if that's what they want? And if they've got a qualification, I don't know what they need, but that particular women seem to be quite highly qualified in what. But just how far we cast that net.
Thank you.
Thank you, Councillor Brown, through yourself, convener. I suppose we can collectively or individually cast our net as wide as we want, given the reach of the internet, for want of a better example. I think in terms of anybody coming to Scotland with a qualification from abroad and looking to work here. In this country, it always depends on whether that qualification is equivalent and recognised by the Scottish Social Services Council, given that social work is a registered profession. So anybody coming from abroad would need to be able to evidence their qualification, and then the SSC, as that national organisation, would have the decision to make about whether that qualification meets the required standard locally. And that would be similar, I suppose, for education or medicine or any of the other professions that are professionally registered. In terms of qualifications from England, they are recognised, absolutely, so that's not a barrier. And I suppose the other element is more broadly in terms of the national recruitment challenge and how we can look to bring people from further afield in to Scotland, and that's something that certainly national agencies and organisations, not just the SSC, continue to have an eye on, and we saw a bit of movement around that through the pandemic, whenever it was appropriate to do so, but also nationally the development of local learning partnerships for the social work profession. Well, I'm sure we're taking account of that as well, because we know that we've got that national recruitment and retention challenge, but we need to continue to be on a bit of a that around.
Thanks very much, thank you. Councillor Brooks.
Yeah, thanks very much. So newly qualified social workers, it's pleased to see 3.10 that there is now in protected learning time identifies at half a day a week. I'm aware of other professions that is also part of their profession squeezed out due to workload. Where's the confidence that we will ensure that that protected learning time is met within our new qualified social workers?
Thank you to yourself again, convener. The supported first year has become mandatory. As I was saying before, we had the luxury, I suppose, of being a pilot area for that supported first year, so it's quite well embedded in Inverclyde. The fact that the SSC oversees the implementation of that supported first year means that, as well as being mandatory, there's a toolkit that's being developed for social work qualified social workers, but also their supervisors as well. So it's important for all team leads to be able to respect that half day a week, to be able to provide that on a consistent basis. So that would be very much down to the operational manager to ensure that. But our learning and development team continue to be involved very much in leading that supported first year, and if there were any particular challenges around that, then of course we want to be able to address that with the individual.
Thanks very much. No, that's thanks for those updates, and also a wee bit of your life story as well. I think the grower one really stands out, because I think it's got that dual benefit of local workers and the chance to increase their skills and ultimately increase their salary while being able to stay here in Inverclyde. So it's got benefits for lots of different parts of our area, so no, that's great to hear. And just remains for us to note the contents of the report. Thank you. We're on to item number 5. Item number 5, naloxone in Inverclyde. And that's over to Maxine to take us through that report. Thanks very much.
Thank you. So whilst the paper does absolutely intend on giving you an update on naloxone delivery, I think more critically, its aim is to establish naloxone in the broader context of harm reduction in all of the methodologies that we use in Inverclyde to support harm reduction, and naloxone is just sort of one arm of that, if you like. So really, hopefully from this report, what you'll see is that broader sense of how we operate in a harm reduction manner across Inverclyde. So naloxone is a life-saving medication that reverses opioid overdoses and is central to Scotland's harm reduction strategy. In Inverclyde, the deployment of naloxone is not only a clinical intervention, but a community-wide effort to reduce drug-related deaths, empower frontline services and promote compassionate care. The Scottish Government launched the National Naloxone Programme in 2011, which was the first of its kind globally. And naloxone is now widely available through community pharmacies, police officers, ambulance services and outreach programmes. It's increasingly evident that the full potential of naloxone in reducing drug-related harm can only be achieved through a collective approach, and realising these benefits requires active engagement and shared responsibility from all partners and communities in supporting and sustaining naloxone provision. From a local context, harm reduction is a public health approach that prioritises safety, dignity and evidence-based interventions for people who use drugs and fits squarely within the broader strategic framework. The immediate impact of naloxone is not lost in terms of how we operate our services, in terms of the effects of reversing opioid overdoses within minutes, preventing death and allowing time for emergency care. Community empowerment, the role of our services in terms of training individuals, especially peers and family members, to administer naloxone, fosters a culture of care and responsiveness. The officer responsible for harm reduction also, including naloxone distribution, also offers sessions around challenging stigma and promoting compassionate engagement with vulnerable populations. And in Inverclyde, this approach is embedded across services through the leadership of the Harm Reduction and Capacity Building Officer, whose remit includes, but is not limited to, naloxone training and distribution, alcohol and drug awareness, overdose prevention, capacity building across services, and reducing stigma related to substance use. The officer also chairs the Local Harms Group, which promotes harm reduction across statutory, third sector and community services. And that's really about making sure that collectively in Inverclyde we understand that this is not an ADRS or an ADP responsibility, that this is the responsibility of everybody who lives and works in our communities in terms of supporting harm reduction and the delivery of naloxone. So whilst there are annual targets, we tend to have a target that is 20 times the number of opioid-related deaths. So our annual target was in 23 and 24 was 480 naloxone kits. Our performance in 24-25, we achieved 73% of the target, although the role and reach of the harm reduction and capacity building officer was still being embedded during that time. In 25-26, we've already achieved 53% of our target by Q2, and Public Health Scotland note that we are likely to reach our target or surpass our target in Inverclyde by the end of the year. So you'll see there that there's the report notes the training that has been delivered across our communities, and that is not just, as you'll see, to our statutory staff, that is across our community partners, third sector partners. The community supply shows how our capacity building officer supports third sector in terms of the naloxone supply to make sure that they are trained and have adequate supply of naloxone for their frontline services. So Inverclyde benefits from national infrastructure such as the Click and Deliver service, which enhances accessibility to naloxone and helps to reduce stigma that might otherwise hinder widespread distribution. The service plays a key role in normalising naloxone provision and supports broader efforts to embed harm reduction within communities. In terms of future development, the planned initiatives, we are expanding naloxone across Inverclyde Council sites. So the harm reduction officer is currently working with the Council's health and safety team to coordinate the delivery of more naloxone training across more council sites. There's some ongoing training with Salvation Army to distribute naloxone to people that they engage with. Rapid rehousing staff are supplying naloxone in community tenancies following the closure of the Inverclyde Centre. We're training the community mental health teams for emergency use and supply, and exploring a peer naloxone worker model to embed naloxone in high-risk communities. There's in section 3.9 there, you'll see harm reduction beyond naloxone. So some of the broader remit of that officer is around alcohol brief interventions, overdose awareness and train-the-trainer programmes, youth prevention to support the national work on substance use harm prevention for young people, engaging with radar alerts and communications, increasing testing rates and partnerships with ADRS and bloodborne virus nurses, and representing Inverclyde on the GGNC-wide stigma working group. So in conclusion, naloxone is a vital tool in Inverclyde's harm reduction strategy, saving lives and fostering a culture of care. The integration of naloxone into training, community outreach and service delivery reflects a commitment to reducing drug-related deaths and supporting people who use drugs with dignity and compassion. However, it absolutely needs to be considered as part of a much broader suite of tools that promotes early intervention, prevention and harm reduction in Inverclyde. Thank you. Happy to take any questions.
Thanks very much for that, Maxine. I know it's been something that's been sort of coming to the panel for a wee while, so that's really good to get that report, and thanks for bringing it to us today. Thomas Mackenzie and then Councillor McCabe. Thanks.
Yeah, thank you for the report. It's very interesting indeed. I'll take 2 points from it. And under the future developments, the training service now start to distribute naloxone to people who engage with and exploring a peer naloxone model, a worker to embed naloxone in high-risk communities. Am I reading this that you're going to give it to drug users to give to their fellow drug users should they overdose, have it within the community, so they're trained to do it. So we're issuing it to drug users. Now, the next point would be, there's lots of statistics in the thing about issuing kits and all the rest of it, but do we have a statistic to say how many lives have been saved, how many interventions have been positive? Is that number too vague a number? Is it too anecdotal? Is it worthwhile? That's the question I'm asking.
Thank you.
So in terms of the first part of your question, I mean, there's a lot of media attention right now around, the provision of naloxone and actually reducing stigma around naloxone. I don't know if you've seen that, similar to you get a defibrillator cabinet on the wall, then naloxone is going to be provided within in the communities in a similar type locked cabinet, if you like, because actually naloxone is one of the quickest responses that you can give to somebody in terms of improving their opportunities for saving their life. So it's really about all of our frontline workers, regardless of whether they're working with somebody who uses alcohol, uses opiates or not. It's about all of them carrying them, because in terms of coming across people who in our communities who have experienced an overdose. So it's really about reducing that stigma and making sure that each and every one of us knows how to use naloxone and we're able to use that. The second part of your question is, going on to that. So yes, so people who use drugs as a part of a harm reduction work that we do with people who use drugs, then we would actually ask them to be carrying naloxone themselves, so that if they are using drugs with other people, then they have got that there as the first responder before they call emergency services. In terms of the second part of your question about how many lives are saved due to naloxone, because of the approach that we take in terms of it is not a statutory function that only we deliver, because there's no way of being able to monitor how often naloxone's used. So unless, so naloxone may well be used, and we haven't got any guarantees that everybody who uses naloxone is then conveyed to hospital, A&E or whatever else, because if somebody is, administering naloxone in a private household and they come round from that, then we have got no way of being able to track that really. And I suppose because we really promote that community responsibility and community accountability around naloxone being everybody's responsibility, it's really hard to be able to understand the data around how often naloxone's used and how often it saves lives, unfortunately. So, yeah.
Councillor McCabe.
Yeah, the provost asked the question I was going to ask, and I suppose the only way we'll know over time is a reduction in deaths. And obviously, at this point, and we're starting to see that, but we don't know the correlation, etc. But I have to say, I mean, it is a useful report, and it's good to see how the rollout has progressed from a standing start, in a sense, not that long ago. I can remember when we had sort of training on it, etc. In terms of that. So it is good, and it's good to see the future developments. And obviously, it is only but one sort of part of a harm reduction strategy. We need to get that into context, but it is good to see that council services, other statutory services, but the wider community are buying into this initiative. So I've certainly thank staff for all the effort they've put in to progress in this, and obviously encourage you to keep rolling it out.
Yeah, thanks.
Yeah, thank you. That's really great. I mean, I would offer a word of caution around the direct correlation between the rolling out of naloxone and the reduction in drug deaths. There's a danger of correlating them very directly and saying that we expect if you deliver more naloxone, you will automatically see a reduction in drug deaths. If you, in terms of the data that we've got around drug-related deaths, we know that cocaine is becoming more prominently indicated within drug-related deaths in Inverclyde, for which naloxone will not save a person's life around that. We know that we saw lots of data and information around the toxicity of some of the opioids, that naloxone may well bring people round the first time, but then people can quickly slip back into that overdose state again. So it's just a little bit of a word of caution that, you know, you won't automatically, by having more naloxone, automatically see a direct correlation between the drug deaths. But absolutely, we should absolutely continue to do that, because if it saves one more life, then absolutely.
Life's never simple, is it?
No.
Okay, thanks. Councillor Law had raised her hand, so I was going to go to yourself, Councillor Law, next.
Thank you, convener. I had a question around the cocaine issue, because obviously from the latest police and fire scrutiny panel, they implicated cocaine in all of the recent drug deaths in Inverclyde. So I was going to ask around that, but I think the question had already been answered. So thank you.
Okay, thanks very much for coming in. Councillor Brooks.
Yeah, thanks, Rosemary. Yeah, I'm privileged to sit on the ADP and hear these good stories, and it's fantastic to see programme come through, and it's a good report. It's very clear as well as they get the figures. But use the to sustain the dog programme. When we were trained, the drug has a shelf life. So the drug in my car, I believe, is out of date. And with a wife who's a senior charge nurse, she asks, how do I get that replaced?
Thanks.
Right, okay, so I suppose I'm just clarifying your question. So are you saying that whilst you get the training, that you're not clear on how you get the replacements for that? That's not part of your training in terms of, right, okay.
That's correct. Yeah, I've got the product, but it's now out of date. I don't know how to change it. I don't know how to get up my new product.
Okay, so if that's somebody that's been trained and doesn't know how to do that, then I think we need a bit of a broader communication about how people can access the refreshed sort of supplies around that. So I'll take that forward and make sure that goes out. Thank you.
Thanks very much. Thank you. Councillor Armstrong.
Thanks very much, Convener. Yes, you see, I was going to ask just the same thing, because I think the kit I've got in my car is out of date. But the other thing I was going to ask, it does seem a long time ago since I had the training. I think it must be about 3 years now. My memory's not great at the best of times. Is it possible to have some sort of just like refresher training? Maybe not the whole thing, but just, you know, just a bit of a reminder. Thank you.
Yeah, and I suppose like where would one go about getting training if there were people out in the community who wanted to access training, where would they be best placed to go for information about that? Yeah, thank you. Sorry.
That's right, that's all right. So yeah, absolutely. There is refresher training and anybody can access that. So the best place that you would find that is on the AIDS, Alcohol and Drugs Partnership website. So they have got everything that you need on there in terms of the services that are delivered, the harm reduction strategies are all on there as well. If it's not on there, then really we should be looking at advising people about how to get beyond the training, how people can get refreshed supplies as well on that. So I'll take that forward and just I'm sure it is, but I just want to dot my I's and cross my T's.
Thanks very much.
Yeah. Thanks very much. I know I'm just rifling through these papers because I know there is something in there about reordering of naloxone supplies, but I'm not sure if it's like a kind of more bulk supply for the area rather than for individuals that it's referring to. Okay, thanks very much though for that and for those questions. That was really helpful. Really helpful to get that report. Thanks a lot. So we've just got to know the contents of the report and